eClinicalWorks recently visited the staff of internal medicine specialists, an 11-provider practice with 8 locations throughout Central Florida, to discuss the positive impact eClinicalWorks, comprehensive electronic health record with unified practice management, has had on providing the utmost care and allowing the practice to maintain their long-term goals. Also discussed was the substantial ROI the practice achieved through the use of eClinicalWorks patient portal. The practice was able to eliminate transcription costs, which were up to $100,000 per year. eClinicalWorks spoke with Dr. Avanish Agarwal, Dr. Stephen Brint, Lisa Berdu, billing manager, Megan Trauber, nurse, Alicia Brend, billing specialist, Nanette Ortiz, front office, and Joseph Tackett, the IT administrator, about their successful implementation of eClinicalWorks.
About 6 years ago, we started to look for a solution for our transcription, because at the time we were a group of 15 doctors, and our transcription costs were over $100,000 a year. And we saw the future was that the government is heading towards EMR and having payments based on that.
We looked at several medical records over about a 1.5 year period of time. We looked at eClinical because it was the most general that fit our practice. It allowed us to be able to adapt over the future, which was important for us. We were looking into being able to get labs directly into our system as opposed to paper, the way that they came in now over the fax.
And so we looked around various options, and we looked at 3 different options. And we, in terms of the scheduling, the billing, and also the electronic medical record portion of it. And then we finally settled on eClinicalWorks.
In 2006, once the physicians decided on eClinicalWorks, we were on a MISA system, so we were completely paper. So my job was to implement the entire practice, over 30 providers, over 100 staff, from paper to paperless with eClinicalWorks. So we first started with, training the physicians and training the nurses.
I love it. Every time somebody asks me about EMR, I'm always raving about it. It's just so much easier to use.
It was a little more complicated before. Now that we have the EMR system, everything is a little more streamlined. Everything is right in front of you. There's not a lot of weird button pushing like there was before with the old system.
Well, it's much better. It's easier. It's quicker. We don't have to deal with a lot of paperwork. Everything is just find the patient quick.
We have a lot of staff here that have been here a very long time, have done this for a very long time with paper. So they're very fearful of not having that paper in their hand. But once they realized everything was right in front of them instantly, it was more of a relief, and then they were willing to learn more about eClinical and be more acceptance of it.
It's easy. Say a patient calls and I just go up to patient lookup and I type in their name and it comes up, and the whole time the patient's holding, so we can discuss their issue. Say they need a refill, just go to new telephone encounter, and I can either go back to look at their old history of prescription, or I can select a new prescription and add one, and then simple as pie is I push OK, and then I send it to the pharmacy. And it's quick and easy and efficient.
And of course, the biggest benefit, of course, is that we saved a lot of money. The money that we were spending on transcription is not being spent, and so we've paid for the system very fast.
Return on investment we've seen almost immediately. We've been able to basically run on the original equipment we bought for the first 4 years. We have replaced our servers to transition to version 9 to meet meaningful use. We have attested all of our GI doctors the end of 2011 for meaningful use, and we are working on transitioning to get the nephrology doctors to meet meaningful use in hopefully the first or second quarter of this year.
Surprisingly, all of my older billing people couldn't even imagine going back to anything else. Couldn't imagine not having accessible to them the patient's information. The billing runs smoothly, claims go quickly, you can find anything you need on the system. I couldn't even imagine going back to paper, and actually nobody else. We try not to even use paper anymore. So it's been really a step up in what we do as a practice and how we treat the patients and the quality of service that we give them.
We implemented the patient portal the end of last year for the GI doctors to get to meet meaningful use. A lot of the patients like the portal. They're able to ask for prescription refills. They're able to look at their previous charts. They're able to view their labs. If they have a question for the doctor or nurse, they send us questions through the portal, which helps your back-end staff not to have to answer so many phone calls. They can do everything from right within eClinical. They can answer the question, they can refill a prescription, they can send a message back to the patient through the portal to let them know that the task has been done. Patients are able to update their demographic information. It's really made communication between your patients a lot easier than playing phone tag.
We see the technology growing over the future, and so we wanted a system that would grow with us.
Internal medicine specialists and eClinicalWorks, improving healthcare together.